Welcome to Endocrine Uncovered, where Dr. G, a board-certified endocrinologist, Tanya and Stacy, nurse practitioners with a knack for making hormones make sense, squash hormone myths, and answer the questions your Google search history is too embarrassed to admit. Welcome to Endocrine Uncovered.
Hi everyone, I'm Tanya,
I'm Stacy.
And I'm Dr. G.
and today we're back and talking about something that's been popping up everywhere. We're going to be talking about hormone pellets, specifically BioTE. So, you all have probably seen the commercials where it's supposed to restore your balance or optimize hormones or bring back your youth. So, we're going to talk about what the real story is and tell you as much as we know, but things are still developing.
They claim it's bioidentical and it's supposed to be more natural and safer, according to the websites.
Right, let's talk about what bioidentical means. So I often love to do this whenever patients come in and they're like, I want to do something that's bioidentical. So I say, what is bioidentical? It is identical to your biology. So we have to ask ourselves, what is that? And identical to your biology would be something that is derived from an ovary, which would be from a human being. And we would never use a cadaver ovary to give you bioidentical hormones. So, if we're going to do something bioidentical, we have to make it identical to your body, which means the only way to do that safely without using cadaver would be to use would be to synthesize it to be identical to the human body.
Yeah, so by synthesize it, you mean make it in a lab somewhere.
Yeah, that's the
Mm-hmm.
only way to do it.
Mm-hmm. Yeah. And when we talk about, how we do that, it doesn't come from a human, but there's other sources that it can come from, like plants or
Mhm.
other animals, and that's not really similar to humans.
Right.
Yeah, so I
Mhm.
think that's an important point, Dr. G, of bioidentical and what it gets confused as, right? So I think when these companies say bioidentical, oftentimes they mean plant-based, like Stacey's saying, or animal-based products.
Yep.
We know
Yep.
that those are not identical to humans.
Right, right. I
Mhm.
mean, just like we always say, the terms natural, organic, and bioidentical, we always have to ask ourselves, what does that mean? And what does this product really line up in that whole scheme of things? So, Stacey, give us a case.
Okay, so this is a case of a patient that's very similar to women that come in quite frequently to our clinic. This is a 44-year-old female. She has been seen for some time she's on thyroid hormone replacement, and she had just come in for her regular thyroid follow-up. And her thyroid labs were a little bit abnormal. So TSH is the lab we use to check thyroid function predominantly, and normal for her is generally has been about between 1 and a 3, and her value was at an 8. And I kind of said to her, I said, has something changed? Has your weight gone up since sometimes you need more as you gain weight? Have you started on any new meds? Have you missed any doses recently? Have you started any new supplements? Are you taking biotin? We've talked about in former podcasts about how biotin can interfere with our assay and give us incorrect readings. And she said, no, 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 none of that. It's all the same. Everything's the same. And I said, well, how are you feeling? Are you feeling particularly hypothyroid? And she said, no, I actually feel really well. But I wasn't going to tell you this, but my other provider told me not to tell you this, but I went and saw this other kind of hormone specialist, quote unquote, and they started me on some testosterone pellets, and they said, but don't tell your other provider because they may not agree with that. And she says, but I kind of wonder if maybe that screwed things up and maybe that's why my thyroid labs are abnormal. But I'm feeling really well on these pellets, and I think I should continue. I have noticed some symptoms, like I've been losing some hair and I've been kind of growing some hair in my face, but maybe that's just my thyroid, since you've told me in the past that hair loss can be a thyroid symptom.
Mhm.
Hmm.
Tanya, tell us about what you know about testosterone effects on thyroid function, or at least the laboratory values and what it means for people's doses.
Yeah, so typically, first of all, I'll start off saying that we don't really have great assays to measure testosterone
Mhm.
levels, right? So that's one thing to consider. But typically, we want to target levels less than 80 for testosterone for cisgender women who are not looking to transition, right? So are not looking to have more masculinizing features. That's the target that we try to kind of keep testosterone at as under 80 because that's when you get the anti-androgen effects of testosterone, meaning that you're not getting the masculinizing features of excess hair growth, hair loss on the scalp because of where the testosterone receptors are, and that causes hair loss. So we see that in male pattern baldness, right? So a lot of that has to do with the effects of testosterone. So if these levels are high and when people are not looking for that, then that's when we're concerned, right? And that's the hard part with these pellets because these levels are oftentimes not, we can't fine tune them.
Hmm. Turns out I did get a testosterone level on her. I wanted to know what it was. Her number was just under 300.
Okay.
Mhm.
So a lot higher than that,
Yeah.
higher upper end of normal of 80.
Yeah.
Hmm.
Yeah.
Hmm.
And whenever someone is on thyroid hormone replacement and they're receiving testosterone, we will often see those TSH values shoot up whenever they're getting those testosterone pellets. And that's because testosterone, as does estrogen, requires more thyroid hormone replacement. So people will come in to see us and be like, oh, I'm losing hair, my thyroid's off. And we're like, well, what are you doing? And they'll be like, oh, yeah, I started this testosterone pellet and now my TSH is 20. And I'm like, well, yeah, that's why, because it really does increase your thyroid needs.
Hmm.
Mm-hmm.
Okay, can I give you another story?
Hmm.
Another patient? Okay,
Mm-hmm.
so I had a about a 62-year-old woman who came to see me, who had recently had breast cancer, and she had an estrogen receptor, progesterone receptor positive breast cancer, and she came in because she was having a lot of hair loss, and her testosterone level was 500, which is quite elevated. If we're saying normal testosterone for women who are not on replacement are going to be less than 40, a testosterone level on replacement, we're trying to aim for less than 80 or 90, assuming they're not wanting to have the androgenic effects. So we have a woman who has a testosterone level of 500. And she tells me that this was given to her by her plastic surgeon. And she says to me that, well, they said that because it was this pellet was testosterone only, which a lot of times the pellets are testosterone and estrogen. So this was a testosterone only pellet, and she was told that I don't need to worry about this because this is testosterone only, and my breast cancer was estrogen progesterone positive.
Hmm.
What do you guys think about that?
That makes me raise my eyebrows.
It does. Look
We
at
we
this.
know that
Those of you on
testosterone
Zoom, look
converts
at
to
us.
estrogen. Yes,
Yeah.
yes. If you see us on Zoom, you'll see the eyebrows are raised. Not on
By
Zoom,
Zoom,
on
we mean
YouTube.
that
On YouTube.
YouTube.
Yeah, yeah. Sorry, YouTube. Yeah.
Um, yeah, testosterone converts to estrogen.
Yeah.
hmm
Yeah, it sure does.
Hmm.
At
Yeah.
certain levels, when it's high enough, yes, it does convert
Hmm.
to estrogen. And for
Hmm.
those who are wondering
Hmm.
about the estrogen and progesterone positive breast cancer, it means that those cancer cells are sensitive to these hormones. And if you receive these hormones, then it can make these cancer cells grow. So oftentimes these patients are put on estrogen blockers, right? So if
Hmm.
now we're giving someone testosterone, we're counteracting that.
Which, by the way, all of you users out there who have been recommended to take an estrogen blocker, stop. Because honestly, the estrogen blockers are
If you're
so
on
bad for your
BioTE,
bones. If you're on BioT,
yeah.
yeah, if you have breast cancer, that's different. But
hmm
these estrogen blockers are really detrimental to your bone health.
Hmm.
hmm
Yeah, which is a whole nother podcast.
hmm
So, yeah,
Yeah.
So
stay
we can
tuned.
talk about that as
Stay
well.
tuned. Yeah. Okay.
So I want to know, what is BioT?
Yeah. So BioT, for those of you who have not fallen prey to the to this is that BioTE are small pellets that they actually insert into your buttocks tissue, so the subcutaneous tissue in the buttocks, and they release hormones slowly over 3 to 4, or actually those of us who take care of patients who are trying to get off of these will see they last for 7 to 9 months, but oftentimes they are given 3 to 4 months, and they usually contain testosterone and estrogen together. And it gives kind of this release over months. The problem with that is if you have a side effect due to this, or you want to get rid of that estrogen or testosterone, you can't because you don't remove it. You can't remove it. You have to wait for it to completely dissolve, and then it's out of your system.
Hmm. Yeah.
So you're just along for the ride.
You are.
Hmm. Hmm.
So let's talk about where BioT originated. So, um, BioT originated from a retired OB-GYN um, that was from Texas. And whenever he stopped delivering babies, like those of you who are in the OB-GYN world or in medicine world in general, when you're no longer delivering babies, the income actually does drop substantially. Now, the idea between the BioT pellets was really to provide this additional support for women that but at that, like, women are paying $300 to $400 a month for this technology that this retired OB-GYN has made. And I will tell you that I don't know, like, truly, I don't think this was ill intended. I think that sure there was a financial gain to be made, but I think the idea is how do we improve the life, and how do we improve how women are feeling who are in the postmenopausal period? And if you listen to our podcast from episode,
Couple episodes ago. A
yeah, I
While
mean, I
ago.
think it was last episode. Actually, I think it was it's our
It's
season
like
two,
season two,
episode two.
episode
I
two.
think is
Yeah.
what it was. Yeah. But if you listen to that, you can see you could actually replace testosterone in a very safe way. And so I'm not throwing them under the bus saying these are evil people that did this. I'm just saying that I think that the idea has become a financial revenue for this company, and we have to think about what we're putting inside of ourselves and whether this is the safest thing for us.
Hmm.
Yeah, I mean, $48 million dollar revenue in just a quarter.
Hmm.
That's
Not
right.
a year, just the quarter is incentive enough. And that
It
always
is.
raises my
Yeah.
eyebrow too.
So, Stacy, tell us about what you learned.
So it was started in 2012, and they have a website that you can go to, and it tells you, they're very upfront about everything that they have made money wise, their revenue. And they have supplements, and in addition to the hormone pellets. Um, and there's a board of directors, and it's some GYNs, some other medical people. There's a whole conglomerate of financial gurus that are on there, but they post their revenue for the quarter, and it was 49 million in third quarter of 2025,
Mhm.
which was down from 51 million the
Mhm.
previous year, but that was because of the new supplements that they had released according to their website. um, and when you want to, like, if you try to find out a little bit more about the protocol and how does this work and what's the science and what's the research behind it, that's the trickier part. So if you want to know, we've never been able to find, I can't find online what's the protocol for how this works, because we get patients in and they say, oh, they told me per protocol my testosterone wasn't high enough, so they gave me a higher dose next time. And I'm looking
It's
at
the
their
secret
testosterone.
sauce, Stacy.
Yeah, it's a secret sauce. And I'm like, your testosterone was 290 and they gave you a higher dose the next time? Oh yeah, because I wasn't high enough yet. And so there's a protocol for this, but in order to actually know that protocol, you have to sign up. You have to, and
Mhm.
they talk about, they train you, you get certified to do this.
Mhm.
So we've got some GYN clinics, we've got primary care clinics, we've got chiropractor clinics, the apparently the plastic surgery clinic. There's lots of these just med spas that are now
Yeah.
approved. They've
Yeah.
been certified to do this.
Yeah. Yeah.
Um, what they don't have is the research, and they don't spout the science. I don't see the scientific studies that say, we tested
Mhm.
this in women, we tested this long term, we looked at, they kind of talk about it may do this, it may do
Mhm.
that,
Mhm.
but there isn't this data that tells me
Yeah.
the safety. That's the part that I
Yeah.
I can't find
Yeah. Yeah.
through their site.
You know what it reminds me of?
What?
When I was a kid in high school, I used to sell Mary Kay cosmetics for my aunt.
Uh-huh.
That's what it reminds me of. You
Yeah.
get your
Yeah. Yeah. Yeah.
certification,
Yeah.
you get your kit, and then you're able to provide this
Hmm.
service.
Yeah. Yeah.
So that analogy, take that with what you
I
will.
love that.
Mm-hmm. Oh, Tanya was a Mary Kay lady.
I
Oh yeah, Mary
know. That's something
Baker.
I did not know about you,
Did you get a
Tanya.
pink car?
No, I wasn't old enough to drive yet.
Oh boy.
So kind of just like to review the whole testosterone values is that normal testosterone in women who are not wanting to raise their testosterone is usually less than 40, right? And our PCOS girls, we're trying to aim to that testosterone level of less than 40 so that they don't have the side effects of excessive testosterone. If you're someone that wants to have a testosterone level that is higher because you enjoy that higher testosterone, we try to aim for levels of less than 80 or 90 to kind of mitigate the symptoms of hair loss, acne, hair growing in places that you don't want it to grow. And if you're going in and you're getting these pellets and you're getting levels of the 300, 400 plus levels, you have to ask yourself, what are the side effects that are going to be associated with this, correct?
Hmm.
Mm-hmm.
Yeah,
There's something about it though, because they give you estrogen too.
they
And not
do.
not
Yeah,
everybody has the kind of masculinization type of side effects either.
absolutely. Absolutely.
Hmm.
There's clearly something different about the pellets than
Hmm.
is as if you got an FDA version of testosterone. Like the rise, if you have
Just
a
by itself.
testosterone on
Mm-hmm.
someone who's on pellets that's like 300 versus someone who's taking testosterone gel that's 300 would be very different, right?
Mm-hmm.
And that's the part where I wish we knew more about these
I
protocols,
know.
because then I think we could
I
have a more
know.
informed conversation with our patients. I never
Correct.
want to be against something or pro something without really knowing more about
Yes.
it. And I
Yeah.
think that's the biggest takeaway for me is that we don't
Hmm.
clearly know how these
Yeah.
pellets work.
We don't have any
Uh,
transparency on this.
we don't know. And I think all I can think about is the risks rather than the
Right,
benefits,
right,
right?
right. Which is why we'll refer everybody back to our episode two, season two, episode two, HS to D, how to use testosterone safely.
Mm-hmm.
Hmm.
Because at least we have some research and some data that tells us what
Correct.
is safe,
Yeah,
you know.
correct.
And
Yeah,
maybe
yeah.
someday we'll have more research on this and we'll
Maybe we
understand it
will.
better.
Yeah.
But I also, I think we need to make sure our patients are educated on certain
Mm-hmm.
contraindications, why
Yep.
you wouldn't take testosterone.
Mm-hmm.
Anybody want
Yep.
to talk about those?
Yeah, so we can talk about, when we think about testosterone or estrogen, even like Dr. G said earlier, we want to think about breast cancer, right? We want to think about endometrial cancer, any cancer that's going to be sensitive to the hormones. So, more our androgens, we want to think about those. I always think about metabolic side effects, because in the endocrine world, we deal so much with metabolic disease. And so, how are these hormones impacting your liver, impacting your cholesterol, your diabetes? I've had a lot of people with type 1 diabetes come in, and now their
Yeah.
sugars are all over the place because they started on these pellets. So,
Mm-hmm.
Right.
lots of different things to think about.
Right. I love that you brought that up, Tanya, because I think it's important for our listeners to know that testosterone antagonizes insulin, which
Hmm.
is going to raise your blood sugars. Maybe it's not diabetes, but it's pre-diabetes, which could certainly escalate to diabetes. And you're right, it does affect your metabolism and it affects your cholesterol metabolism. It can also increase your blood volume or your
Hmm.
red blood cells. So we worry about could we potentially increase the risk of clots in the legs or clots in the lungs. And so I think those are all important things to recognize that We don't have a safety measure to say that this is okay for you to do just because someone else is selling it to you.
Hmm.
Hmm.
Yeah.
And that's the thing when we put someone on testosterone, an FDA approved version of testosterone, there are ways and there's protocols that we
Yeah,
can do and there's follow-ups that we can do to mitigate these
yeah,
risks, right?
yeah,
So this is not saying inherently testosterone is dangerous because it's not if it's used safely.
right,
But this is saying we don't know what this does. We don't know how much you're
right,
getting. So we actually can't say how much
right,
risk you have.
right.
Hmm.
And we want to encourage you that if you're going to do that, is that your provider is asking you all these things about your personal metabolic history, your personal clotting history. Like, what are the risk of you going on testosterone? And then are they advising you about the pros and cons of that? Because if they're not, I would run because you really want to have someone that's paying attention to these things. Stacy, go ahead.
Well, and in addition to the fact that we have no FDA approval of this,
Hmm.
health insurance does not pay for this. So it is costly. Even if you have the money, you're putting out money. There's a reason why we don't
Hmm.
have approval of this, and it's because we don't have the data that tells us it's safe. That's the main reason. So ask yourself the question, A, why did your provider tell you not to tell your
Yeah.
other providers? And B,
Hmm.
why does your insurance not even consider this an option because it's
Hmm.
not FDA approved?
Hmm.
Mhm.
Our
Yeah.
listeners out there, if you have been advised something and you're feeling uncomfortable, listen to yourself. And if you're uncomfortable, then you need to seek other opinions.
Mhm. Never
Hmm.
hurts to get a second opinion.
No, never.
It's true. Be an informed consumer.
Hmm. All right, perfect.
Uh-oh, we have
What do we
hormone
have?
pellets.
Who's doing it? I think Dr. G, you're doing it.
What is it?
Oh, she's still listening.
Oh,
So this call is coming in for Dr. G from Jesse
Okay.
from New York. So Jesse from New York says, Dr. G, I just had a knee replacement and had blood clots. Do I need to get off of my hormone replacement therapy?
That's a great question. So, generally, what we say is that if you have a precipitating cause of a blood clot, that it wasn't caused by estrogen. Now, granted, at the time of the clot, I would go off of the estrogen until the clot resolves, but it doesn't mean you could go back on because you had a precipitating factor. If you did not have a precipitating factor, then yes, you would want to stay off of the estrogen.
and so precipitating factor just means surgery. And when we have
Yeah.
surgery, you are not very active, particularly
Mhm.
if you had a clot in your leg, and you had the knee surgery and you were that leg was just sitting there and not moving, right? So when blood just sits there and it doesn't move, it becomes kind of static and then it can more likely clot. And whenever you do get a blood clot, usually you should have some kind of workup that says, let's make sure you don't have some clotting factor disorder we were unaware of. Plus, let's ask questions about have you ever been pregnant? And pregnancy is a high estrogen state where blood clots you're at a higher risk for. And if you didn't have a clot when you were pregnant, that's probably a good sign.
Mm-hmm.
But doing that workup to know if you have any kind of disorder that might increase your risk for a clot is also important too.
Yep. Perfect.
Okay,
Great question.
I think we're good. Well, thanks everybody.
Yeah, thank
Tune in
you.
next time.
See you next time.
See us on YouTube as well.
Thanks for tuning in to Endocrine Uncovered. Follow us on Instagram at endo.uncovered for tips, updates, and behind the scenes content. Have a question to submit? Email us at askhormonehotline@gmail.com. Don't forget to like, subscribe, and leave us a comment. Listen to us wherever you get your podcasts. Until next time, stay curious and take care of your hormones. The information shared on this podcast is for educational purposes only. Always talk to your doctor or healthcare provider about your individual health needs.
Okay.
That was great, guys.